Hi, my name is Nidhi Sharma. I am a women's health physical therapist here at FuncPhysio Physical Therapy. Today I'm going to ask a question that I often get asked for my patients. Can physical therapy before delivery help and improve the chances of you having a natural vaginal birth? And the answer is yes. But to explain how the physical therapy can help your chances of natural vaginal birth is going to explain some of the mechanics of birth. So just to get some basics, this is a pelvis. We're looking at the pelvis cut from the top, and if we look inside, there is the bladder, there is the uterus, and as you progress through pregnancy, the uterus gets bigger and bigger and takes up the space. To make up for more space for the expanding uterus, these bones of the pelvis, the back, the sacrum, and two sides of your pelvis get a little bit looser, the ligaments get a little bit looser, and these bones start to spread apart to make space. So we're going to look at another model for what happens during birth. Now, during birth, this is the pelvis, and there will be uterus inside here with the baby. And during childbirth, the baby needs to pass through, baby is here in the uterus, needs to pass through this pelvic canal and come out from the vaginal opening. To make sure this happens, it needs to pass through two canals. If we look at the pelvis from the top, you can see a circle here. So the circle is made by this bone at the top, and then this bone on this side, and then this bone on this side. This circle or canal is called the pelvic inlet. If we flip this over, there is a canal on the other side that's formed by the bottom of these two bones and then the tailbone. And this is called pelvic outlet. So in the earlier stages of labor, the baby needs to pass through the pelvic inlet. And in the later stage of labor, baby needs to pass through the pelvic outlet. So you can see how in different stages of labor, different parts of the pelvis have to be wide. So in some stages of labor, we want this to be as wide as possible so the baby's head and baby's body can pass through it. To make this wider, our body has given options. During pregnancy, there is improved or increased flexibility or mobility of these joints. So you can see there are three bones in our pelvis. Why didn't nature just make a big ring instead of these three bones joined together to form a ring? The reason is that nature has given us options to improve the mobility in this pelvis. So because there is a joint here, there is a joint here, and there is a joint here, all three of these joints, you can see, have some mobility. Okay, so this is the left, this is the right, and then of course there's the joint in the middle that usually doesn't have much mobility, but in pregnancy it has quite a bit of mobility. So what happens is, as the baby's head engages into the pelvic inlet, this bone needs to move back. These two bones need to move slightly forward. Basically make this inlet as big as possible, right? And as the baby passes through the inlet and comes out to the outlet, we want these bones to get spread apart and this tailbone to get out the way to make the outlet bigger. So you can see how movement of these bones can make the inlet bigger and can make the outlet bigger. Why is this motion there? It is there so that different parts of the baby's movement through the different parts of pelvis can be accommodated. This motion is very natural to our pelvis, and it is there for us to be able to pass a baby through this pelvis. With physical therapy before giving birth, we make sure you have enough mobility on these joints. There is increased mobility by nature during pregnancy in these joints, but due to posture and different habits, you may have much more mobility on one side and not enough on the other. So with physical therapy, we make sure that both sides of ligaments have good flexibility, good mobility, and both of these joints have good mobility within them. We also teach you how to use this mobility successfully. We teach you how to move the sacrum back and forth with exercises. We teach you how to use these pelvis back and forth with exercises, and basically teach you how to make this inlet smaller and then the outlet smaller. So this I'm exaggerating obviously the motion in this model, but these motions are possible, and with physical therapy we can teach you these motions, enable you, empower you to use these natural motions during baby's birth, so that you're not just sitting there and pushing the baby out and hurting the pelvic floor muscles and fascia. These joints and this pelvis is made so that the baby can pass through easily without hurting the tissues and the fascia and the muscles underneath. You should not have to use a lot of abdominal strength to push the baby out. The baby should be coming out. It should be the uterus that's pushing the baby out, and it should be the pelvis that moves to allow the passage of the baby through vaginal canal. So I highly recommend, if you are hoping to have a natural vaginal birth, that you consider some prenatal physical therapy to learn these motions, coordinate these motions, and empower yourself with better skills and more knowledge. Thank you.